This week on the Wheelhouse, the final day of the legislative session is here. Which bills will pass and which bills will be punted to next year? For a Connecticut Public, I'm Frankie Graziano. This is the Wheelhouse, the show that connects politics to the people. We got your weekly dose of politics in Connecticut and beyond right here on the final day of the 2025 legislative session. That's why many of you tune into the Wheelhouse. Inside the state capitol, it's anything but quiet. After 6 months of negotiation, debate, and some political drama, lawmakers are racing to the finish line. From education to housing, climate change to Medicaid, the General Assembly has tackled some of the most pressing issues facing Connecticut's residents. Today, we'll find out which bills make it across the finish line and which ones get left behind. Who will take the floor, who will walk away disappointed, and who will leave feeling like the fight was worth it. That's what I'll be digging into today with the help of my guests. Our first one, Susan Raff, WFSB News Channel 3's chief political reporter. Thank you so much for coming on the show.
Good morning on this very big day.
So good to see you this morning. You brighten my morning.
Aww.
I appreciate having you on. Mark Pasniokis, Capitol Bureau Chief, co-founder of the Connecticut Mirror. Look at him at work. He's ready to go for the final day. Welcome to the Wheelhouse.
Good morning.
They don't make him as professional as Mark Pasniokis, I can tell you that. And also joining us, he comes by way of Zoom, WSHU senior reporter Ebong Udama. Good morning, Ebong. How are you?
I'm doing good. How you doing, Frankie?
I'm doing well. You're ready to go. You just had a warm up. You had your show, and now you're ready to go here. Thank you so much for coming on the program.
Good morning, and you look very handsome this morning.
Well, thank you.
He does.
Yeah.
Ebong, very handsome gentleman. You can join the conversation, folks. 888-720-9677. 888-720-9677. I guess the first question is going to go out to Mark. Just after midnight last night, the Senate gave final approval to the biennial budget. Breaking news. Some of the priorities in this budget, what are they? And how difficult was the fight, would you say, for the approval to come?
The fight really was behind the scenes. It had to do with the three-way negotiations that goes on every year. And they were particularly acute this year between the governor's office, the House Democratic majority, and the Senate Democratic majority. And their biggest sticking point was whether you were going to do a child tax credit or were you going to do some other form of tax relief for low and middle class households. And they ultimately decided on a compromise that does use the housing credit and some other things to help folks at this point. But the child tax credit, which has been a legislative Democratic priority for a long time, that's going to have to wait to be fully developed in other years.
Ebong, what do you think people are thinking right now? Are there some lawmakers walking away unhappy? And if so, what are their concerns?
Well, the Republicans are definitely walking away unhappy because they were shut out of the whole budget negotiations. And they were not happy about that at all. And also, they feel that Lamont has compromised with the Democrats and adjusted the guardrails. And they're very upset about that. That's the fiscal guardrails for the budget.
You know, Susan, it seemed like the Republicans were actually in lockstep with the governor in the last few years on the guardrails. And there is a supermajority for Democrats, so they don't have to really talk to Republicans. And some of the things I heard behind the scenes yesterday while at the Capitol weren't very complimentary to Republicans, to say the least. They basically don't think they have any business being involved in any parts of the negotiations because of those majorities. But this year, for the Republicans, just not getting what they want in terms of the guardrails and at least saving money for the long term.
Right, and I think it's difficult for the governor. I mean, he's may decide to run for election. He's also campaigned on being fiscally conservative, right? So he has said, he doesn't think we should adjust the guardrails. Those were bipartisan rules put in place for a reason. They were used to fix the Medicaid shortfall or the deficiency that we have. Connecticut does have a huge reserve, about $4 billion, but it does go against that. And so the governor sided with Democrats and agreed to do that. So he's got to be careful if he wants to say, we need to abide by those rules and then changes them.
Paz, I've been following the reporting of your great colleague at the Connecticut Mirror, Keith Phaneuf, who is all over the finances in terms of, what we're going to do with Medicaid. And that has a big part to do with the guardrails here. The federal government essentially not doing Connecticut any favors. We haven't seen the big, beautiful bill have final passage yet. But when you're talking about billions of dollars potentially being taken away, or there's also the threat about Medicaid funding because Connecticut provides care to undocumented migrants under 15. I don't know how much room Connecticut had to maneuver here. What do you think?
Well, the good news for Connecticut is that there are a lot of red state governors that have pushed back very hard at Congress on doing some of the cuts that have been discussed. Some of those cuts would have been rolling back the 90% federal compensation level for states that expanded their Medicaid coverage. Connecticut is one of those states. It's been very important. It's been far-reaching. About 40% of all children born in Connecticut are born into families on Medicaid. So that was very key. And then there's this, call it a kickback scam, but there's been something in place for a long time where states can have a wink and a nod to their hospitals. They can increase the taxes on hospitals to increase their Medicaid reimbursements and then kick back essentially, some of those taxes. And this is something that now 49 states use. It's pretty clear Congress is going to cap the ability to endlessly do that, but they're not going to eliminate it. So those were some of the really huge concerns. But in the broader sense, there was disappointment because Connecticut only made some modest increases in Medicaid reimbursement rates, which really had not been touched since 2007, 2008. And, if you're trying to get a specialist or perhaps even a pediatrician in some areas, those Medicaid reimbursement rates are problematic to getting care for your kids.
Right. And I think Republicans were upset with good reason. The Democrats could have opened the budget last year and fixed that Medicaid deficiency, but they didn't. So then they were faced with it this year. And as Mark said, it is very true. A lot of people don't realize how many children in this state and disabled people rely on Medicaid. And then there's the uncertainty of what's coming on in Washington. So I think at a time when, we have used or gone outside the fiscal guardrails, we have to be very careful because we just don't know what the future is going to be.
I don't know what the future is going to be in terms of how much we hear the term fiscal guardrails. That might go away soon. What are we all going to do in Connecticut? Ebong, what's your take on the federal funding impact here? I want to save some of the discussion for later with you and I in the C segment here on reactions. But at least in terms of federal funding, Bob Duff, I got to talk to yesterday, the Senate Majority Leader. He's saying, hey, Washington doesn't have its act together. Connecticut does. I think we have a balanced budget. I don't think they do in Washington. And certainly that's what his response was to the federal impact. What are you hearing from other lawmakers?
Well, whatever the case, they'll have to come back in the fall.
Okay.
To do some adjustments because we don't really know what's going to come out of Washington right now. The Democrats are talking about it being really bad. The Republicans say, well, let's wait and see. But whichever way, there are going to have to be some adjustments done in the fall. I don't think they can get around that.
Susan, you hearing anything about when we're going to come back?
I haven't.
When lawmakers will, or when there'll be a special
I think
session?
Ebong is right. I think it's going to be sometime in the fall. I mean, Connecticut has already lost quite a bit of money for public health and education. And the big question is what's going to happen, with Medicaid. And so we have to wait and see. But there's no question, the Speaker has said many times that we're going to have to come back and figure out what to do with the budget. And yes, Connecticut is in a fairly decent spot right now with a huge reserve, right? But will that be enough? And, we have to hold on to that.
has any kind of business that might need to be taken care of if it doesn't get taken care of today?
No, they will wait to see what the federal picture looks like, and then they most certainly will come back. There does not seem to be anything that will be left undone by midnight tonight, which is the constitutional adjournment deadline. They do have some fixes and tweaks to the budget that passed last night in the Senate. But their must-do list is pretty much taken care of. The Senate has a climate bill that passed the House earlier in May, and Marty Looney, the Senate president, says they will indeed give that final passage today. It's not a terribly ambitious bill. It's really aspirational. It reiterates and sets some goals, but it really doesn't do a whole lot more.
This is important that you brought that bill up because I talked to several lawmakers about it yesterday. This is a bipartisan effort to address energy, as I understand it, SB4. And I think they got to come and talk about it in the House, Susan. And a lot of this discussion is around the public benefits charge.
Correct. And you don't often see Republicans and Democrats agree on a lot, and they were brought into the room. This was really, the result of a lot of pressure from constituents, right? Lawmakers heard from people saying, we're angry, we're frustrated after some very high bills last year, and now we're going into the summer months. So I think that this is an effort to take a portion of the public benefits charge off the bill and give people, I think it's about $100 million a year for several years, and then there are some more savings long term. But there's no question there was a lot of pressure to do something about this, and this was definitely a bipartisan effort, and it will make a difference. But keep in mind that money has to be borrowed, and all taxpayers will eventually pay that. But it will take the burden off of the ratepayers in the immediate future.
So,
I believe
go ahead, Ebong. Yeah, jump in there.
They were saying it would take about $10 a month off the average residential bill, and a lot more of business customers. So, $120 a year is something,
It is. It's definitely something. It's not going to solve all the state's problems, and even there seems to be an agreement with that the lawmakers have to come back next year and tackle energy and figure out what Connecticut is going to do in terms of long-term energy plan. We don't have one. This is a start. A lot of them say it's a step in the right direction. Will it be enough to make people happy? It might be. Again, they wanted something done.
Oh, there is a lot to talk about on energy, and we have tried to do it in the past. But again, we are downwind of major polluters, and that's one impact, and we're at the end of the gas line, so there's a lot of things to get into, as we always do on the show, and we'll save some of that for next week when we talk to Michaela Savitt on the Wheelhouse. So stay tuned as we continue to talk about these things. If you want to talk about what's happening today at the Capitol, give us a call, 888-720-9677, 888-720-9677. Paz, there's a lot to be happy about in this budget, I would imagine. We're talking about childcare. We're going to have Commissioner Beth Bai on from Office of Early Childhood coming on right after this segment, and Ava Bermudez Zimmerman as well from Childcare for CT. We're talking about capping the cost of childcare for some and then allowing others to have free childcare. That's one. You're talking about addressing the public that charge on electric bills. That's another thing. So they're obviously having to address a lot of things that are happening at the federal government. So there's some positives there, negatives from some folks, besides Republicans not necessarily happy with the fiscal guardrails.
Well, the Republicans opposed the Early Childhood Initiative because it's an off-budget item, and that was one of the major compromises that the governor did make on the fiscal guardrails in return for what is really the signature achievement of this session.
But in terms of maybe it's I'm looking for other groups here that may not be happy. Is it nonprofits? Is it higher ed? Who may not be getting something that they want out of this budget?
UConn is losing a lot of money in the second year of the budget. Nonprofits are, I don't mean this in a dismissive way, but nonprofits are rarely happy. There have been progress in fits and starts over reimbursement rates. The big winners this year are the folks in nursing homes. The reimbursement rates will go up there to pay for higher wages that are the result of a threatened labor action. But other than that, it wasn't a terrible year, but there won't be any celebration in the nonprofit community about what they're getting. I mean, once again, this is a constant struggle for Connecticut, that many key services are provided by private nonprofit providers at far lower rates. The agencies can do the job because of lower wages and lower benefits. So this is a struggle that we will see continue to next year when they do budget adjustments and beyond.
Right. I think this was a very big year for Connecticut's working families, right, and middle-class families, because let's face it, people want to work or stay in their jobs, and they can't if they can't afford childcare. I think nonprofits, I agree with Mark, they did okay, kind of flat-funded, but they didn't get any cuts. I think the most contentious thing, and this is the one thing that Governor Lamont has said he's going to veto, and that is the bill for striking workers. And we saw that highlighted with Pratt and Whitney. The governor did not like the bill last year, and he doesn't like it this year. It would allow people who are on strike to collect unemployment after 2 weeks. Businesses pay into that. Governor Lamont feels it's anti-business. Republicans do as well. I think the unions have kind of said they are trying to strong-arm the governor to change his mind, but I don't think he will. So they didn't come out on top, certainly, but it is a big year for working families.
Big year for a lot of people in Connecticut. There's a lot of money to go around, particularly for children and their families, and even got the child tax credit in there. But the session is coming to an end. You guys are going to be jumping out of here pretty soon because there's a news conference at 9:30.
There is a news conference. I think they're going to take up bonding today with new school construction but the heavy lifting really has been done. The energy was a big thing that came in the last few days. The budget as well. They're just going to tie up some loose ends. But they'll take a little break and then come back in the fall and figure out what they're going to do with Medicaid and other shortfalls from Washington.
This is a day you don't necessarily like. It's the last day you get to go to the Capitol for a while.
Yeah, I love the Capitol. I really do. I've covered it for a long time. And it's a learning process. You really get a sense of how legislation is proposed, and you watch it go through. And I think a lot of people who are there care about the state of Connecticut. They may disagree on how we get there, but I enjoy it, and I'll miss it.
Ed Bong's going to stay with me. Paz, you're leaving too. Just give me a quick final thought here as we leave you, and we're about to hear from Democratic lawmakers at 9:30, at least you will, and people will be able to follow up on that at ctmirror.org and ctpublic.org as well. Go ahead.
The Speaker and Majority Leader in 5 minutes are going to put the best possible spin on the last day, and then tomorrow we will hear from the governor, who will try to frame what was done and what wasn't done in the best possible terms for him either to eventually announce a bid for the third term later this summer, or simply to try to take a first crack at framing his legacy.
What's your premonition,
Mark? You'll hear
now you got to give me, whoa. You can't leave before that. Give me a percentage. Are we at greater than 50%? I'm doing the Dan Harv percentage check here. Is it greater than 50 or less than 50 that the governor is going to run again?
I have given up on trying to read the tea leaves with Governor Ned Lamont and what he, based on the conversations I have, it changes from day to day. He is aware that at the end of a third term, he would be 76. I think there's been a little news in politics nationally about the age of some of our elected leaders. So I think that weighs on his mind. But on the other
76
hand,
is a spring chicken compared to...
he's a spring... Yeah. Well, if he was in the Senate, he'd be in the median. But one thing I'll tell you is his wife is not planning on retiring, so perhaps the governor won't either.
Yeah. I also think he's evolved. I think he likes the job now. I didn't see that when he first took the job. He butted heads even with Democrats. But he seems to have come into the job. He likes it. And I think Democrats and the party would like him to run.
You love me now, but you're going to get mad at me if you don't get out of here because you got to get to the
Okay, so I'm
Capitol
being
here by
forced
9:30.
out.
You got to get out of here. I love you. I
come
don't want you to
back?
get mad at me. You can
Can
come
I-
back
All
whenever
right.
you want.
I got a
Okay.
This
job
is going to
too.
be your
Bye-bye.
summer job. I'll see you later, Paz. This is going to be your
Thank
summer
you.
job, Susan, to get you over what's happening at the Capitol. So stay tuned for more coverage of what's happening from lawmakers as we have our great reporters following up with them. We'll be digging deeper into the final day of the legislative session with our guests, Ebong Udama. Thank you to Susan Raff, Chief Political Reporter for WFSB News Channel 3, and also Mark Pazniokas, Capitol Bureau Chief and co-founder of the Connecticut Mirror. After the break, we're going to zoom in on early childhood education. A sector may soon see a significant overhaul, one that will have implications for a lot of families across the entire state. Stay tuned. This is the Wheelhouse from Connecticut Public Radio. I'm Frankie Graziano. While much of the lawmaking for 2025 is slated to end today, a bunch of business has already been tended to, including what many in Connecticut are calling transformative legislation for local children and their families. This past weekend, the state legislature passed a bill that should eventually provide support for child care for every kid in the state. Here to mark this moment in early childhood development are Beth Bai, the commissioner of the Connecticut Office of Early Childhood. Good morning, Beth. So happy to see you here on the show. Thank you for coming in here to Hartford, where you work. And another advocate for the children of Connecticut, Ava Bermudez Zimmerman. She's the coalition director for Child Care for CT, a group of local nonprofits fighting for affordable care in our state. Good morning, Ava.
Good morning. So excited to be here.
What does your shirt say?
Fixed childcare. People can't see it, but it says fixed childcare. And
Yes.
we should add a D for fixed childcare, the commissioner's idea.
I was going to say, I think you guys did a lot of work on that this year.
Easy.
Let me invite folks to join the conversation. Do you think that they fixed childcare? Are you excited about it? Give us a call, 888-720-9677, 888-720-9677. Beth, you both were there when the bill passed, or at least you're in the ether here. What does it accomplish for families?
Yeah, it was such an exciting evening when the bill finally passed. What the bill accomplishes is it really expands child care for the state, but I think first and foremost it's going to make it more affordable for families, and it's also going to help child care workers who've been subsidizing the system for decades get paid on par with public school teachers, those that have the credentials.
Ava, your reaction to it, I know that I saw some photos from you. I saw some photos from some of your other colleagues, including Izzy Cohen, were there as well. What do you think?
You probably saw some photos of us dancing.
Yeah.
We had providers and parents at the Capitol when it actually happened live. And there were some dancing photos, some shouting, some tears. It was an emotional moment to think of the first time in 40 years that we finally have the providers and the parents have been seen in the state. It's just a monumental achievement. And it wasn't an easy accomplishment. It was one that was through a collaboration. Like you mentioned, Child Care for Connecticut is a coalition of advocates, parents, providers, nonprofits, over 70 nonprofits coming together and saying, now's the time to fix childcare. So enthusiastic.
I'm going to highlight the work of another nonprofit here. I want to highlight a statement now from the Connecticut Project Action Fund and CEO Garth Harries, who says, every family from every background should have the financial freedom and peace of mind that come with affordable, quality child care. He calls this a historical bill, taking a transformative step. There's Garth right there, toward a Connecticut where universally affordable quality child care from infancy through preschool is a reality. Why is this, as the word Garth uses, transformative?
Well, we coined it. You didn't hear us? That's our word, transformative. Transformative, we accomplished it because the first time in the nation that we've done something of this kind. A lot of states, they were just aiming at trying to get salaries up for providers, trying to get a cap on costs for parents. They were doing different attempts for different things. But here with the commissioner, we saw that the broken system is not just the affordability or not just the fact that we're not paying providers what they should get paid. It was a combination of a lot of deficiencies. communities. And through her leadership, through the collaboration and advocacy, we did something historic and transformational. We're taking all of those broken pieces and saying, rather than keep funding a broken system, we're going to help our economy. We're going to make sure that parents get to go to work while simultaneously giving them infrastructure and giving them access to healthcare.
Let's get into the teeth of the bill in a little bit. First, I want to ask you, Commissioner, why is it important to do this? Let's understand this. I brought this question up to Paz and Susan earlier about nonprofits and about higher ed. We talk so much about them when we consider the budget and flat funding or whatever. But how important is it to meet families earlier in the lives of their children, and certainly people that are coming from lower socioeconomic backgrounds?
Yeah, high quality early childhood is important for all families in Connecticut, and I think Governor Lamont has had a real vision since COVID, and he saw what it meant to have childcare. When those hospitals were worried about how are we going to staff during COVID, he talks about that as a moment for him of realizing just how much childcare is a part of our workforce infrastructure, is a part of our state's economy. And I was telling Ava, he called me about 10 months ago and said, hey, if we could make an investment in an endowment that would be there forever using this unallocated surplus, we could make a difference for the long run. And I was just blown away. It was after the Blue Ribbon Panel report, so he had been hearing about that. But I think that's what he does really well. He listens, and as he listened to business, he listened to families, he came to family child care homes, he listened to providers, and he realized that this is really a missing piece of Connecticut's infrastructure for success. So I think that's been exciting to see that at the highest levels, Connecticut is saying, this will distinguish us from other states. You have paid leave, now you have child care. If you have a family, this is a great place to be. We were already great, but any great leader builds on their strengths.
Ava, where do you see this bill helping now, immediately, once July 1 comes around?
Immediately, we have an opportunity for bonding money. So in the budget, we're talking about SB 1. I should highlight that the success of this legislative session is not just SB 1, the bill that's the universal endowment. The success also is the fact that we have bonding money in the budget for infrastructure, and we also have another bill, HB 5003, that allows for a portal to make it easy and accessible for child care providers. That combination, three-pronged approach of trying to tackle costs, infrastructure, and also access to benefits for child care providers is the monumental and transformational change. So I will say that the success of all of these three bills have allowed us access for more money for child care owner-operators and directors, access for immediate changes that are to come. There's also a caveat there that says we cannot supplant the existing funding. So a big fear from advocates coming into this session was, yes, please, we need benefits, we need access, we need to help and stimulate our economy with new slots, but don't rob them from the existing programs. And we did that. The commissioner doubled down that we have these programs that are awesome and in working, and we want to help working parents. So Care for Kids is not seeing no one's stealing Care for Kids funding or other subsidy program funding. They are there, and we're adding more support, and we have this new transformational idea.
Yeah. Eventually, Commissioner, pre-K will be free for children from families making under $100,000 a year, and for others who exceed the threshold, their costs are going to be capped at 7%. My wife and I did the math the other day when Charlie and Annie were going to preschool at the same time, and we were paying about $3,000 a month or something like that. That was about 16% of our income, or something like 17% of our income.
That's about the Connecticut average right now.
Yeah, I would have liked it to be around 7%. But it's not going to be 7% in the short term. It's going to take a little time for that to happen.
Right.
Help us understand
exactly. That. It is 7% right now for families on Care for Kids, and we're moving that way in our existing state-funded spaces, about 18,000 spaces. Plus, there are 19,000 spaces in the schools. Most of those are less than 7%. So there are still really affordable options right now. And in the short term, we'll be adding a few thousand spaces over the next couple of years. But the big change comes in 2027, starting in July of 2027, when we'll add 16,000 spaces. And I think one thing that is being left out, but during the Blue Ribbon panel, we really heard from parents of preschoolers of children with special needs. And the public schools just have a lot of half-day programs, so parents are having to pick between their child getting services and working. And so this bill, this endowment is designed to help school districts fill that gap and give them funding to turn those part-day, part-week programs into school-day, school-year programs. So while I say we add 16,000 spaces, there are another 5,000 to 7,000 families who will now have an early childhood program that will allow them to work. Right now, it's so difficult for parents of 3- and 4-year-olds with children with special needs.
And so difficult, as you talk about pay, and going through this myself and my family and seeing other families as well, you're talking about people that are professionals working in the space not getting paid a lot. They're having kids that have developmental and intellectual disabilities that they're caring for, and they're not getting paid that well. And they're also taking care of babies, and we know it costs more to take care of babies. And there's just a lot going on in daycare right now, and a lot for people to deal with. So it sounds like this money can help.
Yes, it does. I mean, as advocates, I've been at this for 35 years. We said we have to break the link between what parents can pay and what child care workers are paid, because the child care workers have been taking less than what they deserve to keep the system up, to hold the system up. And this says now it's a partnership that parents have a share, providers will continue to do their good work, but the government will have this endowment that will allow it to work. Yeah, exactly.
The first step historically in early care where we really tackled payment is Service Employees International Union unionized nationwide childcare providers, and the state of Connecticut was one of them. So they created a childcare union here in the state of Connecticut, and then in the negotiations got the pay significantly higher for providers. But that's just for the Care for Kids program subsidy. And one of their partners of Childcare for CT, and one of our asks with our partners and CDCs and also other childcare providers who own and operate and don't have the ability to be a union member was, you have to look at us. You have to understand that it's been on our backs and we have no mechanism to try to get more money because the money is just not there. So this is finally an opportunity to pay providers more. The program allows payment comparable to public school teachers, which is significantly more for that per pupil cost than what most providers get right now in their average childcare space.
Childcare for CT working on this, groups within there, and then other groups as well, including the CT Project Action Fund, all our kin involved in this. Social
Impact Partners, the Early Learnings Collaborative.
These people are happy. There are other people that are not happy, and I just want to address that really quickly. I think I got a statement here, Beth, for you from Vin Candelora. He's a House Minority Leader. You guys were in different chambers, but
no,
you guys were in
friends.
different chambers, but you guys are friends.
Sure.
Here's what he says about he's worried about future spending habits. He says, quote, "It really is the beginning of the end of good fiscal practices for the state of Connecticut. He believes the state's going to be diverting from now on surplus dollars into a fund to allow off-budget spending." And that's kind of what Paz was getting into earlier. What do you think about his concerns? What can you do to allay them? Or has the governor, have you tried to address this with how you all tried to tackle this?
Absolutely, and I appreciate Vin, and he's been a supporter of child care over the years. I would just say that I have a fundamental disagreement with him, as does the governor. The governor's a businessman. He knows how business works. He knows what a good investment is. There's no better investment that this state could make than early childhood education. What else gives you a 13 to 18% return on investment? So the governor's not simply saying, here, take this money and spend it. He's putting in an endowment. It stays on our books. We only spend 10%. Meanwhile, that 10% investment is bringing a 13% return on investment. So I see this as accelerating the state's economy. And I think it is in line with the thinking that it's sort of paying down a future debt. When children come to school ready to learn, it saves us money. When parents can work, it helps them afford a house. This is an investment in our economy.
Bill is all set to go. When will it be signed? Do we know if it's been signed? I don't think it's been signed.
It'll be signed soon. We're very excited about that. And I'm excited. The most exciting thing to me on that night it passed I tear up just thinking of it, is coming out and seeing childcare providers who'd worked a 10 or 12-hour day, then came down to the Senate and sat in the gallery till 9 p.m., women who've been doing this for 30 years, having a hard time supporting their families. But they're there advocating for everyone. And I think I'm excited for the bill signing to have the providers be there and also the families. When we hear from families about the struggles paying for childcare and trying to work. So we're going to stay focused on the families and the field, and ultimately we believe in them and we're investing in them.
I got a couple of minutes left with Ava and Beth, so give us a call, 888-720-9677. Maybe you want to know how this works for your family, 888-720-9677. You better call us ASAP because they're going to go pretty soon. But when Beth said that and she talked about the moment, Ava, I'm thinking about those Zoom calls that you had. Mm-hmm. I think you had like hundreds of people, maybe even thousands of people on these Zoom calls during the pandemic with people having all kinds of issues. Do you start to think about the work that you've had to do over the last 5 years? I know you've been doing it for longer, but particularly these last 5 years.
It's a little insane that it came from a concept of just survivalists, right? Trying to make sure that we're navigating COVID with providers. Izzy Greenberg, Meryl Gay, Liz Frazier, and I started these calls there were 3 times a week. Then it was exhausting, so we switched them to 1 time a week. And from 50 people turned to 100, and yes, 1,000 people. We broke Zoom in a time that nobody knew what Zoom was, and here we are 4 years later, in the finish line, finally, with something real. So the road was rocky, the road was long, but again, this is a team effort. Different partnerships got us here too. So the juxtaposition between having, and you mentioned Republican Vinnie Candelora, the minority leader, in his comment, I want to point out that this organization and this advocacy, this is not about Democrat or Republican. This is about doing what's right for children, doing what's right for the economy. You know, having in the same space union locals as well as CBIA is not that common. But till the very, very end, they were both advocating for fixing childcare, and that's what's real here.
Help me understand what's next. What else can you do? I know that there's going to be a lot more work to do, and not everybody can afford childcare as is, and that's what you've obviously tried to do. The wages haven't always been great, so that's something you're also attempting to do. Federal programs, we understand, are in jeopardy. I'm not sure how much you'll need them after getting this support, but maybe you can enlighten me. So help me understand what's next.
Yeah, so next steps for the Coalition for our advocacy is ensuring that the programs that are now an opportunity for like health insurance and that hopefully will be implemented very soon are accessible to as many people as possible. And this is for parents and providers. That means money, of course, and there is a limit to how much money could, in theory, be added into this endowment for the parent end, but we want to make sure that there's also more money for the benefits, right, for the childcare providers. We made significant strides this year to ensure that there's $10 million accessible for health insurance. When we look at the numbers, obviously, with this many providers in the state of Connecticut, we're looking at more like $100 million that's needed for that difference in health insurance. We're also wanting to expand beyond the 16,000 slots. We won this fight. We are trying to celebrate right now, but there is a lot more work to be done. And hopefully 2026 and 2027 session, we're able to grow on the wonderful success we had this year.
You get the final word, Commissioner, in terms of what you think about what's next and maybe addressing some of those things that Ava was talking about.
I think what we've done is built a really unique system here in Connecticut through the Blue Ribbon Panel Plan. And it relies on local governing councils. So what's next is the towns are building their own capacity to understand what their early childhood needs are. This has to be grounded in data. And we're developing a portal so any parent could go online and put in where they live, what their income is, and see what the free and reduced cost options are for them, because there are some for all families now. It's just, it's like Rubik's Cube trying to figure out what's going to work for your family. So this makes significant IT investments over the next year. The governor wanted to be sure we're adding thousands of families in the next 2 years. The rates will go up over the next 2 years. We're going to be doing apprenticeship and workforce pipelines so we get more workers. So it's sort of preparing for 2027 when it launches. So getting the workforce in place, getting the locals we need to know what the towns need to be able to provide what they need.
And
The
town
portals-
halls.
yeah, go ahead.
Town halls to make sure that people know about what's happening. So no one's going to be left in the dust or in the dark. We'll have conversations with advocacy and OEC to make sure people know what's going on.
Portals. Is that HB 5003 there?
Yeah.
5003?
Yes,
Yeah,
Is that passed yet?
Yeah, Kate Farrar's
passed.
work on 5003 was fabulous in the House, Representative Farrar, and that is going to that had a number of provisions, but one of them was the portal. And as Ava said, this has 100 mothers. This came together because of so many people, and the portal is being used successful, something like that in Colorado and South Carolina. So we have other states to look to, but it's confusing now.
From Connecticut Public, this is the Wheelhouse. I'm Frankie Graziano. The work to make the cost of living for families in Connecticut more affordable never stops. Our guests today were instrumental in the passage of the big child care legislation of 2025. Beth Bai, the commissioner of the Connecticut Office of Early Childhood. I haven't seen you in a while.
Great to see
God
you.
bless you. God bless Tracy. It's good to
Yeah,
see you.
You too.
Also, Ava Bermudez Zimmerman, a coalition director for child care for C2. Thank you for coming on the show.
Thank you for having me.
So good to see you in person here.
Likewise.
Our panel returns to react to what we just heard, but also just kind of give us an idea. It's actually going to be just Ebong. Ebong and I are going to talk about what happens next and more reaction from lawmakers on the final bills here as they try to cross the finish line. You can join the conversation. 888-720-9677. 888-720-9677. You're listening to The Wheelhouse on Connecticut Public. This is The Wheelhouse from Connecticut Public Radio. I'm Frankie Graziano. A flurry of activity inside the Connecticut State Capitol today during the final day of the 2025 legislative session. We're going to find out which bills make it across the finish line, which bills fall short. Really, most of the work being done. There's going to be some bonding things happening, some little discussions here and there, as I understand it, from talking to Ebong Udama, senior reporter for WSHU. Great to have you back on the Wheelhouse here, Ebong. Let's finish up here.
Frankie.
Let's finish up here. We just had the child care discussion, and we only have a few minutes, so I'm going to kind of move away from that now. A lot of people are excited about child care. So let's kind of now shift our thoughts into the neck of the woods to where you work here near Fairfield County. Always an effort to try to get more housing available to folks. What are you understanding about any kind of housing legislation?
Well, I think that's the big one for the towns in Fairfield County. There was a lot of opposition to the housing bill that passed. Basically, they felt it was taking over local control of zoning, and there was a lot of pushback. And Democratic majority leader in the House, Jason Rojas, he put this whole thing together. He was kind of the architect of this housing bill. And what he said is that when they started out, with something that was pretty demanding of communities, and getting the feedback, from their town halls and other interactions they did. He said they were able to craft something that was a lot more balanced. I don't think it went down very well over here as balanced
Because of the reaction from lawmakers?
And right now, it's passed the Senate, it's passed the House, it's passed the Senate, and so it's up to Governor Lamont. And the grassroots organizers here are lobbying Governor Lamont to veto the bill, which I don't think he'll do.
Why would they want him to veto it? Can you help us understand that a little more?
Well, they say it's too demanding and it takes away local control over housing, over zoning. It requires something called fair share, which requires districts build a certain number of residential housing, affordable residential housing. And it has transit-oriented housing, work to live right, and it eliminates some of the parking regulations, the number of parking spaces you need to have for certain houses. This is something that some of the legislators from the cities were against as well, but they seemed to have a compromise, but it wasn't enough. It was if you have a development with under 24 units, you can effectively reduce the amount of parking spaces that are allowed, and it also it had something to do with architecture of parks and not having armrests on park benches so people could sleep, things like that. So it went into a little bit of detail, but they're pushing back. They're lobbying furiously to get the governor to veto it, but I don't think he'll do that.
Ebong, the bill aims to increase housing supply, cut down on rent prices, and encourage use of public transit, among other measures. These are measures advocates have been calling for a long time. Maybe they would disagree that it needs to be vetoed.
Well, there's a real big push. Housing advocates have been pushing for this for a long time. That one of the reasons why the state is so segregated is because of zoning laws, which in most suburban communities does not permit multifamily housing, and this is trying to edge into that and get a little bit more housing, multifamily housing into suburban communities.
The fiscal guardrail conversation, how does that extend to housing? So are there folks that have seen the governor and lawmakers? I'm thinking about that meme. I've seen what the Lord can do for you. Can you do it for me? Are they seeing that with the loosening of the guardrails? Can they see that potentially helping out more affordable housing efforts in Connecticut?
Well, the governor has been putting more money into state housing programs, but the thing about the fiscal guardrails, the feeling is that once it's a slippery slope, and once you open the floodgates, I can't think of the metaphor to use here, but
the avalanche is upon us.
Basically, once you start spending surplus money on things other than paying down the unfunded pension obligations, you now open it up to a situation where you'll no longer have the surplus money. And what Vincent Candelora said is he thinks it's not a smart practice for the state to do this. However, there's a lot of pressure because we've got a huge surplus.
Okay, so we got about a minute left, Ebong, and you got into one person who was unhappy. You talked about Vin Candelora. Let's just finish this up by trying to talk about who might not necessarily like what's happening with the state budget process. Are there groups that you could point to? Are there lawmakers in the last minute or so here?
Well, I know that a lot of Republicans didn't like it, and they didn't like the fact that a number of bills that didn't make it, they actually put it into the budget. For instance, the AI bill that made it in the Senate didn't make it into the House, but segments of the bill made it into the budget. For instance, and this is something that will go up against the big, beautiful bill that we have in Congress, because they have pretty much a ban on states passing any legislation to do with AI for the next 10 years.
About 15 seconds left, Ebong. Yeah,
and they were able to tuck it into the budget, and it basically the whole thing about generating AI, generating likeness. I don't know. Yeah, pretty much likeness of a person.
Ebong Udama, WSHU senior reporter. Thank you so much for coming on the Wheelhouse today.
Thank you, Frankie.
Today's show produced by Chloe Wynn, edited by Robin Doyen Aiken, technical producer Eugene Amatruda. Thank you to Megan Boone and company. Download the Wheelhouse anytime on your favorite podcast app. I'm Frankie Graziano. What a show we had for you today. This is the Wheelhouse.